thanks for stopping by. Today I'm going to be talking about occupational therapy in honor of OT month, that is the month of April, and we'll be diving into the history, the importance of occupational therapy, and perhaps you're looking to get into the health field and you're just not sure which setting that you'd be in. I'm here to describe occupational therapy, why I love it, how important it is, the history of it, so let's dive in. The need for occupational therapy was first recognized after World War I, when they were realizing a lot of the soldiers coming back from the war were suffering from mental illnesses that made them a threat to society, and these soldiers were then thrown into mental institutions which were very inhumane, and they actually were separated from society, treated in different ways that what you think of like mental institutions, like with the straitjacket and the padded walls of the room. And over time, it was recognized that they needed skills to help them perform basic self-care tasks, which we now call ADLs and IADLs. And they figured out how to make it a therapy to help them figure out how to take care of themselves and to gain independence using what they called reconstruction aids. So fast forward to a couple decades later, they created a program that kind of like gathered all the data of those reconstruction aids and saw like their methods, different things that helped, and it focused on helping people be able to rehabilitate back into society. And it was a strong precursor in mental health. And occupational therapy was first found in mental health. And fast forward to today, you see occupational therapy just exploded, and it's in different settings in the healthcare field. You have pediatrics, you have hospitals, mental health clinics, outpatient, like it has just exploded since then. And in a nutshell, occupational therapy uses something called activity analysis. And what that is we basically look at anything that you do, anything that is of meaning to you in your daily life, whether it's getting dressed, whether it's getting your bills paid, socializing, different things that you do throughout your day that are meaningful to you and also functional. We look at those tasks and we figure out the different parts of that task that may be difficult for you to perform. So in this case of someone who's just recovering from a stroke with their whole right side being immobilized, we'll look at a task to see, okay, how can they dress maybe with one hand rather than the function that they had before, being able to do it on their own with two hands. So we basically look at all the parts of an activity and what you need to do it. For example, in order to put on your socks, you need to be able to have muscle strength to, pull that sock. And it looks different in every setting. The settings that I work in, I primarily work in pediatric occupational therapy from kids ages birth to 3 years old. And what is a birth to 3-year-old doing? Well, they're primarily playing and they're learning about their environment through exploration. They explore their environment through play, and they sleep, they eat, they are learning how to dress themselves depending on the culture setting and the parent expectations is what we work on. So a lot of the kids learn through functional play. So we figure out all the things that the kid is expected to be doing and that the parents would like to see them do. And we break down the different parts of that activity. We figure out what's the most challenging and we work on it. Early intervention's a little bit different because it is very family focused. And so it is kind of, a lot of the states are taking more of like a parent coaching approach rather than like the medical model, where in the past, the medical model was mainly the therapist going into the home, going into the daycare and interacting with the child and, just having therapy with them. But now it looks more like the therapist going in, having a conversation with the caregiver, getting observations, and having the caregiver interact with the child throughout the session and providing tips and feedback on how to help give that child the support they need to develop in a healthy way. Now, in a rehabilitation setting, we work with people who are recovering, and the key word there is rehab. Now, we want to help them restore their function as close as to what they were before they were coming in. And that means if they were independent, if they were able to do things on their own before they went into the surgery and had that recovery process, we're gonna want to help them build up the strength and the stability. So there's a lot of strengthening in a rehab setting, a lot of exercises, and a lot of basic activities of daily living. So we help make sure that they can, take a shower, get dressed, all that stuff. We provide them with adaptive equipment. So we do use something called compensatory. Oh my goodness, I'm gonna have to make sure I'm saying that right, but you know what I mean. We help them compensate with adaptive equipment to help them perform that task better, whether it be a toilet aid, which I'll show a picture of, and it's basically something that if they are unable to rotate their trunk like this, like think about all the stuff that you have to do just to wipe your butt, for example. Like there's so many ways. Some people have to bend and twist and turn around and put your hand back there. Some people can't do that because of spinal precautions or limited mobility, whatever it may be. Also, people recovering from hip surgeries, they might not be able to bring their leg up. Don't know if you can see me completely, but they cannot bring their leg up and turn it onto their knee to put their sock on. A lot of people put their socks on sitting or standing, but what they would do is they will turn your leg inwards. So we figure out how to do that. Like we look at every single part of a task, we break it down, we help them figure it out. It's like a lot of problem solving. I absolutely love what I do because it allows me to be creative, and I have a new challenge every day because every single person is different. If you'd like to learn more about occupational therapy, like, follow, and subscribe, and I'll see you around.